Melody, do you want to go ahead and get us started today?
Sure, be happy to. Good afternoon, everyone. Thank you for joining us today. For those of you who don't know me, my name's Melody Anthony, and I'm the State Medicaid Director at the Healthcare Authority. We want to make sure that everyone has a better understanding of all the flexibilities that we have done under the COVID-19 emergency declaration. So Traylor and I are here to give you information and to answer any questions you might have. So I'm going to turn it over to Traylor.
Thanks, Melody. For those of you that don't know me, I'm Traylor Rains. I'm the Deputy State Medicaid Director at the Healthcare Authority, working in Sooner Care Operations. I just wanted to start out with a couple of housekeeping items. We do have a Q&A function, if you notice in the bottom of your screen. For any official questions submitted for today's session, please use that box instead of the chat box, as we will be downloading all of the questions after this to post to our COVID response website along with written answers to the questions. Also, having mentioned that site, I will say that we have dedicated a page on our public site at okhca.org/COVID-19. We have all of our resources available out there, as well as after this, we will post the recording of this session along with those written questions and answers. I'll go ahead and start. I'm going to share my screen here. Let's see. That's wrong one, sorry. Okay, maybe not. I know I'm pressing the right thing, but it's not bringing it up. But I'll walk through the flexibilities that I wanted to highlight initially, and then we can open up for questions and answers. We did want to let you know that the state applied for an 1135 emergency waiver. It was a new process to most of us, if not all of us. But we did request certain flexibilities specific to this provider group that were granted. We had specific authorizations given to us as a state, and then CMS, based on a lot of the requests from other states, went ahead and issued blanket approvals for those. So I'll start with one is the waiver of the 3-day hospitalization requirement that is typically required in order to cover a skilled nursing facility level of care. The CMS has waived that requirement during the emergency period. And for clarification there, the emergency period began on March the 13th. And it will go until the president declares that the national emergency is over. In addition to that, we have also received approval to waive the, I'm sorry, there's something going on. We have also suppressed requirements for hitting the minimum data set, and that will be for the entirety of the emergency period. That's for those skilled nursing facilities beds, as well as made revisions to our PASSAR reviews. We did put a global message out on our website. If you look at the provider tab on our public website under global updates, we did notify providers that we are changing the way we do PASSARs. We received approval to suppress PASSAR reviews for 30 days, but our PASSAR staff have informed us that they've been able to make accommodations with facilities and have been able to either do level 1 and level 2 by telephone or through telehealth means, which would be a two-way video audio connection. And so until we hear that there's issues with that or problems that we're running into on a case-by-case basis, we'll go ahead and still do those level 1s and 2s, but using electronic means and telephonic means. Like I said, if we hear back from our nursing facilities that that's becoming a problem or that they don't have the technology available to them, then we can reevaluate at that time. Another issue that may affect this provider group is across the board for all providers, we have suspended accepting paper claims for reimbursement. So we will only accept electronic claims submitted through the portal or an EDI vendor at this time, due to limited staff being able to actually receive and process those paper claims, since the Healthcare Authority has converted to nearly 100% telecommuting at this point. All right, before I open up to questions and answers, Mel, do you think I missed anything or anything you want to add in?
No, I don't think so. I think you covered it all. Thanks, Trailer.
All right, so if you have specific questions, again, I'll refer you to the Q&A box and instead of the chat box, that way we can record all of these and respond in writing afterwards. So we'll open to questions if you have some specifics that we haven't covered already. Oh, I do see something about a rate in here, so we'll touch on that real quickly. We have been working with the association on what an add-on rate would look like in response to treating and receiving COVID-19 positive nursing facility residents. We have received authority through our 1135 to be able to prop up a temporary nursing facility that would receive those COVID positive patients that we would need to evacuate from their current facilities in order to reduce contagion. So we are working with Steve and others to see what that would look like. Right now, let's say if a nursing facility wanted to extend a location, they could do that by just opening up a temporary provider location in their, which would be in addition to their current contract. And you'd be able to go into a facility that's not currently licensed or enrolled with the healthcare authority. I believe the State Department of Health is also putting guidance out on what they will deem to be an appropriate location, but without having to go through the full licensing process. In addition to that, we have had conversations on what the additional cost of staffing and supplies would be to specifically care for a COVID-19 positive population in a nursing facility, and are exploring options around funding that, how quickly we could possibly get a rate done. As you know, that when we do rate changes, we have to go through several state and federal processes that require public notice and specific time around tribal consultation. So we're seeing what flexibilities we have there from the feds, and then looking at other states that have also done something similar. So hopefully we could mirror that process if it's the direction that we end up going. We will, of course, have to assess our budget capabilities. You may have heard that we are receiving a 6.2 federal participation enhanced rate during the emergency period, which is aimed at assisting the states with covering the costs of the extra services that would be provided during the emergency period. As you know, or may not know, we've opened pretty much every service covered by Sooner Care up to telehealth. So we're allowing the GT modifier where we may not have previously in the past. So we expect some increase in utilization due to that. But we're also here to help all of our providers. We know that you're the ones on the front lines right now. We see you and we appreciate everything you're doing to continue providing the high quality of care that you are for our members. So we want you to be able to do what you need to serve the clients, and in turn, we want to be there for you to make sure you're taken care of as well. So I do see some Q&A coming through. So how will you determine when outside providers, i.e. medical providers, et cetera, are allowed back into facilities? And do you have any expectation when that will be? I don't know that I will defer to others on the lines that work more closely with our nursing facility providers, but I believe that we have left that up to the facility to determine what is safest for their environment and their milieu, to determine who is safe to allow in and what precautions you will when allowing outside guests in. But my guess is that would all be flexible during the emergency period. So we wouldn't enforce any actions, whereas typically we would have expected someone to physically be present in the facility. We won't enforce that during this time. We'll allow the facility to make that determination. So the next one is there going to be a rate increase or add-on for PPE and staffing for residents? Facilities have been purchasing PPE since January 1st, and this cost is whether we have positive residents and our staff. So we are working on we've been provided information as to the cost of this, additional PPE, as well as staffing to care for COVID positive residents, and we are evaluating those options. And as budget allows, we will continue to explore implementing that. So the next question is, again, with regard to increased rates, which to reiterate, we are looking at that closely. So there's a question about, I did mention MDS submission suspension. That is correct. So on those skilled nursing facility beds that would have typically required the minimum data set submission, CMS has given us authority to waive that during the emergency period. So you don't have to submit that information during the emergency period. And again, the emergency period began March 13th and will end whenever the president declares that the national emergency is over. The next question is, with the healthcare authority working remotely, have there been any hiccups in billing, et cetera? We actually haven't that I know of. We were able to kind of pick up and transition to telecommuting within a couple, 2 to 3 weeks after the emergency was declared. We currently have not suspended any prior authorization requirements or other usual business because we have been able to rely on our technology and our existing staff to continue that those processes are going on smoothly. But I would open that to say too, if you experience any of that, please reach out and let us know through our provider services hotline. That way we can address it and troubleshoot as quickly as possible for everybody. So there's a question on, can you get paid without doing submissions? And I'm gonna assume this is in response to MDS. I will defer to Fred or Jennifer on the call. Is anyone familiar with the condition of MDS for payment?
Hi, this is Jennifer. Can everyone hear me?
Yes.
Are they referring to specifically the pay for performance program or just submission of MDS data in general?
I'm going to guess MDS data submission in general. Is it currently tied to reimbursement?
Well, currently with the pay for performance program, we utilize the historic CASPER report for the quarter, which does contain some MDS data. But what we've done is we have gone alongside what CMS has recommended in terms of a 30-day delay for that specific quality criteria. They have until April 30th to provide the CASPER report to us if they're referring to that specific program.
And Trevor, this is Fred. In addition to that, for our regular Medicaid payments, those are not tied to MDS data, so we are able to make our regular payment with no issues at all.
Okay, thank you for that. And so there's other questions around MDS not being submitted at all during the period. We can get further clarification from CMS. Unless Jennifer, do you know, have you seen updates from CMS in your shop around, will the data set need to be submitted for this period when the emergency is over, or are they just waiving submission during this time altogether?
The last information I received from our CMS contact was as of April 6th, it was a 30-day delay from the March 31st deadline. I will definitely continue to research that, and if I hear any additional updates, I'll let everybody know. But from what I understand, they have a 30-day delay for their MDS submission.
Thank you for that. Another question around flexibilities from CMS. Do we anticipate future waiver activity that has not been released at this point in time? And are there any elements of the Oklahoma submission from a couple of weeks ago that are still pending or been updated? So we will, good question, we will be updating our list. If you go to the COVID-19 page, we do have a list of 1135 flexibilities. Initially, CMS went ahead and approved about 5 of the requests that we submitted and then said that upcoming approvals would be forthcoming. Since that time, they have provided blanket waivers that addressed several of the items that we requested but didn't get specific approval on for Oklahoma. So we are in the process of updating that list, and we'll get that posted to the COVID-19 website today to let you know still what's pending. We only have maybe 3 items pending with CMS that we haven't gotten specific authorization on. Melody did reach out, or has reached out, to Jackie Glaze at CMS, who's the main contact on these, multiple times, and they assured us this morning that the team is getting together and is reviewing and should have further approvals forthcoming. So the ones that would be of importance to this group is we did request presumptive eligibility for the long-term care population. Typically, presumptive eligibility is only something that is available for children and pregnant women. So we did ask for the long-term care population with the understanding that DHS operations may be affected due to no face-to-face meetings for financial eligibility and medical eligibility. So we're waiting on that one. We've also asked in our Inter-Oklahoma program, which we have the individual plan and the employer-sponsored insurance plan, with the understanding that we're going to have a lot of individuals facing unemployment during this time. We're asking if CMS would allow us to accept an attestation of unemployment for purposes of eligibility for Oklahoma, whereas currently they have to have proof that they're receiving income from OESC for unemployment. We've also asked permission to suspend premium obligations for the Inter-Oklahoma individual plan during the emergency period. And the others are related to FQHCs, rural healthcare centers, as well as our Indian, Native American tribal clinics, and allowing them to bill telephonic services where they would not have normally, and be able to provide services outside the 4 walls of a clinic. All right, I'll give it another second or so to see if we have any more questions come in. Y'all are a lot easier on us than our provider group yesterday. I have a general question, maybe if, for you all, maybe if Steve wants to answer, if there's another facility online, what has it been like for the facilities to obtain PPE? And what processes are you going through to obtain that? Or have we received assistance either at the state or federal level, specifically for this provider group, or are we having the same issues that every other provider group is in obtaining it? So I see PPE still incredibly tight. Question around, will we still be getting our Inter-Oklahoma premium assistance payments? Yes, absolutely. So we are a center for disabilities that have LOA paid days up to 60. Will that be increased? That I have not heard. Fred or Jennifer?
The question again.
They're asking if the LOA paid days will be increased from 60 days.
Are they talking about therapeutic leave days, or what is the question exactly?
For disabilities that have LOA paid days up to 60. Yeah, I'm not familiar with what LOA is.
Oh, so currently we do have therapeutic leave days, and again, hard coded in state plan. So for any changes to be made to that, we have to go through the public process to be able to make any changes. So there hasn't been, those days has not been elevated. After yet, if I should add to that.
Let's see, so there's a question, what are some of the most frequent questions that we've been contacted for? Mostly outside of this provider group around coverage of telehealth services and which those apply to, what we're allowing by telephone as opposed to traditional telehealth, interactive two-way audio. Again, if you're curious to see what the other provider groups have asked, we will be posting all of the recorded sessions for the various webinars to the COVID-19 website, as well as written Q&A. And so I haven't told my internal group this, but my hope is that we can get them posted hopefully within 24 hours after the original webinar, so that the one yesterday, or we'll try to get answered in up today or early tomorrow. That way they're available prior to the next day's session. Again, that website is okhca.org/COVID-19, and all of our resources will be posted there. So is hospice being reimbursed for telehealth face-to-face visits with residents in long-term care? Mel, do you know on that one? It seems like I've seen a notice go out on hospice, but I can't.
Yeah, well, I'll have to go back and double check. There was some sort of determination made, and if it's not clear on our website, we will definitely clarify it through this Q&A session. So the question was, just to make sure I understand, hospice services via telehealth in a long-term care facility.
Yes.
Is that right? Okay, I'll make sure we get that answered.
Okay. All right. I haven't seen one coming in a second. So before I kick it over to Mel to wrap us up, I do want to say that, again, to reiterate, we know we definitely understand and hear the difficulties you're facing during this novel time, and we definitely appreciate the extra work you're putting into this, as well as the additional cost you're facing. So we do continue to look at that and to be able to determine what it is we can do from a reimbursement standpoint to help with that. Our CEO, Kevin Corbett, is in constant contact with the governor in his office. So we're getting direction from that level of leadership as well as we make these decisions and move forward. So Mel, I don't see any other questions coming in. If you want to wrap us up.
Wrap us up, I'll be happy to. Thank you again for participating today. We do want you to know that if you need an additional webinar, if you will just reach out to myself or Trailer, we'll be happy to schedule another one in the future to keep you up to date on what is going on at Care Authority. But the most up-to-date information you can find is on our COVID-19 webpage. Our communications staff updates that probably daily as things come in from the federal level and from the governor's office that we need to communicate to our provider community. So thank you again very much, and know that we will get through this together.